Health Focus is brought to you by National Medical Stores, NMS, passionate about your life. When the COVID-19 pandemic hit the world, countries implemented various public health and social measures across the globe to suppress the SARS-CoV-2 transmission and reduce mortality and morbidity from the infection. These included personal protective measures like physical distancing, avoiding crowded settings, hand hygiene, mask wearing, cleaning, disinfection, testing, genetic sequencing, contact tracing, isolation and quarantine, and international travel-related measures. However, several countries are adjusting these measures due to a decline in the infection rate. The East African Sectoral Council of Ministers has since made adjustments to be implemented immediately. For example, Kenya lifted the wearing of face masks in public and restrictions on gatherings. Recently, Rwanda lifted the use of temperature screening at the entrance of public venues and deemed it irrelevant. Health Minister Dr Jane Ruth Aceng, who also represents Uganda on the council, explains these adjustments.
The East African community have their measures that they take, guided by the East African health ministers. And we clearly indicated that right now within the East African community, the infection rates are very low. And we are trying to encourage countries to get as many people vaccinated as possible. The same measures that are being taken in Rwanda are the same measures that are taken in Uganda, because we work within an East African community.
Uganda has since removed the requirement to have PCR tests for fully vaccinated people using land border points, and all PCR results from accredited labs in East Africa are recognized.
If you've received 2 doses of the vaccine or at least 1 dose of Johnson & Johnson, you are free to cross without the need for a test. However, that does not cover for the airport, because the airport brings people from outside the East African community. So if you're going through the airport, you will need to do a pre-exit PCR test or a pre-entry PCR test.
But Dr. Aceng says we are not out of the woods as yet.
We are not dismantling structures of COVID as of now. Until our vaccination coverage reaches 70% of the population, not of the 22 million, of the population, then we shall be sure that the country has herd immunity. Because people who get infection, that immunity does not last. We need to get people vaccinated. So even as our positivity rate goes down, remember that there are over 17 countries right now that are having a serious pandemic. They are having lots of infections and their hospitals are all full. So we cannot hide our heads in the sand and say, dismantle the units. No, the units will remain there. In the event that we get any challenges, we are prepared.
Uganda has also maintained a positivity rate of less than 1% for several weeks, which is a good sign towards suppression, according to the Ministry of Health. More than 19 million doses of the COVID-19 vaccines have been administered, and the Ministry of Health has a plan in the pipeline to vaccinate children.
And as we continue with vaccination for adults, because the 70% coverage is of the population. And so we have grouped children into 5 to 11 years, and 12 to 17 years. This entire group needs the Pfizer vaccine. Currently, we have some Pfizer in country, not adequate for the children population, but we shall start vaccinating the children. Our preparation has begun, and as soon as the schools are ready, we shall embark either between May and June, or beginning early July, but it is best done when the children are at school, because then it is easier to reach them. So we call upon all parents to get information about this vaccine and prepare their children to get vaccinated. COVID is still with us, and we can still get another bad pandemic. What has helped currently is that most of the teachers, actually 90% of the teachers, are fully vaccinated. And that is good. It is not only the teachers, also the teaching staff.
Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities